So I'm Celeste. I am the Director of Admission for our pre-licensure programs here at the School of Nursing. You've probably gotten emails from me. This is what I look like, the real person behind the emails. But I am available, of course, via email and things like that if you guys have questions afterwards. I know a lot of people have reached out already with their admission-specific questions or program questions. Feel free to keep reaching out about those. But this session is about our students, so I'm going to have our students introduce themselves. If you'll say your name, if you'll say what semester you are in the BSN program. I'm not sure if all of you will be in the same one or not, but and then maybe where you were before you came to the BSN program, whether that was Emory or another institution.
Okay, I'll start. I am Rachel. My name is Rachel Yan. I started at Oxford College. This is my second semester at, I had to think about that. It's my second semester at the nursing school.
My name's Sarah Keene. I started at Emory on the Atlanta campus and also second semester at BSN right now.
Speak. It should be good.
Hi, I'm Mackenzie Moore. I did my first 2 years at Oxford College, and I'm also a second semester BSN student.
Hello, my name is also Rachel. I am also a second semester BSN student. I am a transfer student, so I just started here this past fall.
What school were you at before?
I went to a college in New York called Pace University. I don't know if any of you know what that is, but if you do, cool.
So I'll start out with a general question, then obviously we'll open it up if you all have questions for our students too. So why did you choose Emory for your nursing education?
So as a transfer student, before I came here, I actually did not know what Emory was, surprisingly, but when I was looking at schools, different schools to transfer to, Emory was at the top of my list. I visited the campus, and I fell in love, I'm sure, as you all have seen. It's beautiful. They have a wonderful nursing program. We're ranked number 3, I believe, now. The faculty is really nice. They are all supportive. I just think that the opportunities here at Emory are so different than any other school that I looked into, and that was something that I wanted to be a part of.
So I came from Oxford, so I knew specifically I wanted to do my pre-nursing requisites at Oxford College, and that I wanted to go to this nursing program. One, just because of the class sizes, you get like certain type of special attention, and especially in your clinical rotations, you have like 4 to 5 people. And so you just get this sort of like one-on-one experience with certain professors and your, clinical experience with your nurses that you don't really get elsewhere. So that was kind of it. The experience you have and the opportunities that you get here, I'm sure they tell you this, you hear this everywhere. It's unlike any other place, so we're just going to say the same thing. But it really is, and you just get a sort of experience and preparedness that I don't think you get at many other universities. And so I kind of knew that from the get-go, that I kind of wanted to go here for nursing, and it worked out.
Okay, this works. To be very honest, I initially came to Emory because I ran track and cross country here, and that's kind of what brought me here. But when I got here, I realized that I'd never actually considered the career of nursing, and after meeting people who were studying nursing or even pre-nursing, I just realized that, oh, like this does seem like the right thing for me. And then when I was trying to navigate, is this something that I want to do, it became very easy for me to like talk to people and meet faculty, and that's how I kind of like fell into it in a way. But I feel very lucky to have kind of found it, and I think that the fact that you guys already know that this is where you want to come and do pursue that is amazing. But I feel like later we'll talk about the things that we've realized now, but for what actually brought me here, it was kind of luck, I guess I would say.
I was pretty similar to Mackenzie. Like, being at Oxford, I'd already taken the pre-nursing classes, and I knew the class sizes would be smaller, and our clinical experience, like hands-on experience that we've gotten in clinicals and labs, have been phenomenal. So, yeah.
And for any transfer students in here, I realize that the Oxford College Atlanta campus thing can be confusing. So Emory University has 2 different campuses, one out in Oxford, Georgia, which is Oxford College, and one is here, of course, the Atlanta campus. So when they say Oxford, that's what they mean, not Oxford over in the UK. All right, so do you all have any specific questions for our students who are here today? Yeah. If you want to, yeah, we'll grab the. We have a mic, we're recording it, so we want to make sure the people recording can hear your question too.
So for any of you, I work. So I was just going to say, how do you guys feel, like, how manageable is your school work-life balance if any of you work and have a job? Because I pay for a lot of things, so it's important to me to be able to continue to work and also still be successful in the program. So I would say, how do you do that? And also, like, how much do you feel that you can do? I mean, I know I'm not gonna be able to work full time like I do now, but how much do you think is realistic?
Yeah, so that is a very real thing, and it's overwhelming to think about, but I think once you get into your schedule, you're going to realize, oh, I do have a decent amount of time if I prioritize it correctly. Not to go too much into financial aid, but it is possible that you'll qualify for federal work study once you get your package, and with that, it is essentially when you are federal work study qualified, it kind of makes it easier to get a job on campus. Like, you're prioritized because you need it, like, it's in your package. So there are a lot of student jobs that are you originally, like, are you a transfer student, or what's your
Yeah, I'm a transfer student.
Okay.
I go to Georgia State now.
Awesome. So there are a lot of jobs that are, like, on, like, technically, like, main campus. Like, you'll have all of your classes are going to be in this building, and it's going to feel, like, weird in a way, but it's very easy to walk over the bridge, and, like, there's a giant community there, but there's a lot of jobs there, and there's also jobs that are within the nursing school. So there's, like, research-based jobs, there's, like, a lot of food industry type jobs, there's, like, jobs at the gym, library. There's a lot of opportunity to get a job. And to answer your question of, like, to the extent of how much are you going to be able to work, it's just going to depend on what else you're doing in your day, and you're going to find, like, entire days that you will have time to kind of dedicate to that. And I can speak on my experience personally. I've worked a couple different jobs, but right now I work at the Woodruff PE Center, and our shifts are, like, 2 hours. So it's very easy for me to find 2 hours in my schedule on, like, random days to, like, then work. So will you be able to work 20 hours a week? I don't know. But will you be able to work, like, 6 to 10? Yes, definitely.
I additionally work a little differently, just because knowing me and my schedule, how much I like to, like, commit to, especially, like, being involved on campus. I also work, like, part-time at Barnes & Noble, but I do that over breaks. So any single time that I'm home, I'll work over Christmas break, summer break, and then I do that so that I sort of can have that extra time during the year. But I know, like what Sarah said, like, she's very well balanced and can do it all. But I just do it in that way so that I can have a little more flexibility with my time, just because it's a lot to juggle. It's doable, but I just do that. I still work, but I like to save it all up and then work probably too much during my breaks that you should be using to relax, but that's how I do it and how I prefer. But I feel like it's definitely doable, and there's a lot of opportunities, and then especially they'll give you opportunities. They even email about babysitting opportunities, because some nurses will come and trust nursing students who are BLS certified and have experience, and they'll come and be like, different opportunities to watch their children. And so you get a lot of opportunities in that way besides work study, but that's personally how I prefer to work.
All right, another question.
Yeah, so we've heard a lot about the academic support offered to students in the program by faculty and other resources, but I was wondering if there's any sort of, like, emotional health, mental health oriented support.
So yes, there are a lot of resources, I'm sure, as you guys have heard. for academics, there's Nest, or if you want, you can schedule one-on-one tutor. You can do a lot of different things, talk to your professor, office hours. But for emotional support, there is an office, I believe. You can just go talk to them, sign up. I don't know how many sessions you get or the structure of it, but I do know that it is there and that it is accessible. And more than academics or on top of academics, like your professors, your faculty, your staff, your students, like we all want you to be okay. And especially with nursing, since it is a little overwhelming, and I'm sure you all can agree, like your mental health can deteriorate, you can get stressed, but people are there and it is available, so do not worry.
I'll also say, like, the perks of being an undergrad student is you also get Emory University resources too. So CAPS, so like counseling on campus, is also available as well.
I'll give like an official answer too based upon that. So CAPS is like the overall Emory University counseling services. We have 2 specific counselors that are embedded in the nursing school that are specific for nursing students. Because the experiences you may have throughout clinicals in your programs are going to be different than other students at Emory. And so there are 2 dedicated students, or not students, sorry, we have students up here, 2 dedicated counseling staff members that are hired just for the School of Nursing to work with you all. And I mean, you guys can probably talk about this too, but faculty and staff are here, they're around the building a lot. And so like we see things that happen and your faculty are going to be tuned in to you both academically and obviously like your mental health state. And so like, we pay attention to students when they're around the building too, just in more informal ways to make sure that you're getting the resources that you need.
And then on that note, I was just going to go the cheesy route and say, while faculty and the nursing school in general has a lot of different resources and they make that widely known and available, I felt like nothing was more valuable to me and like the times where I was like, God, this is hard, than other students. Like nothing works best than speaking to peers who are going through the same thing. And it's hard now, especially coming from Oxford. I kind of understood that it was hard at first not really knowing a lot of people in your class. And the class sizes are big, so it's hard to connect with everyone. But you do, and you meet people in your clinicals, in your labs, and in smaller settings. And you can easily have those conversations. And to me, that's what's most valuable is complaining to like these guys about an exam or something. Or like, God, clinical was hard today. Sarah was in my clinical, so that was quite fun. And you bond. And I felt like that was, because sometimes it's hard to approach faculty and it can seem like, oh, they won't care, or it's hard to ask for accommodations. But they are more than willing to provide them, and they make that widely known. But it still can be hard to like approach your peers are invaluable. We're big complainers sometimes, but that's great.
All right, other questions? Raise your hand if you have a question. We have one in the front here.
What's the hardest part about nursing school? Is it like time management, sleep deprivation, workload? Like what's the hardest part? And like how do you cope with it?
The thing that I remind myself of like every single day is one, as hard as it is, it's privileged to be here. This is 2 years of your life, and that's going to open you to like the rest of your lifetime. So am I getting the most hours of sleep in this 2 years of when I'm 20? No. And does it suck? Yes. But I am kind of just, none of us, I would say, are like facing extreme sleep deprivation. I think that there's definitely weeks that everyone's like, dang, like I have not slept enough this week, and everyone around you is like drinking Celsius. But it's not to the extent of I can't do this. And kind of as we were just saying, if it does get to that point, there's ways to get around it. And to answer your question of like what specifically is most difficult, I think my personal experience would be like to stay connected to the people not inside this building. It's very easy to be like so incredibly close with the people that I sit right next to for 8 hours a day, or I'm at a hospital with for 12 hours a day. Like there's like no disconnect there. But in terms of like my family and my friends, of just being able to keep up on like what's going on in like the people that I care's lives, I've felt like a little bit like oh, maybe I'm not doing enough in that way. But yeah, I would say more like my personal relationships.
I'm gonna say, for me personally, like, I mean, sure, I got 3 hours of sleep, probably 2 nights in a row. We had 3 exams and then another one on Monday. And then it's kind of, the things in themselves are not hard, especially if you are in control of your time. And like, that may seem like a hard thing to acknowledge, is time management is very important here. But I think what was hardest for me is not necessarily the content or the clinicals. Your clinicals and labs, they may seem like a lot and really daunting, but they're honestly very fun. And those are the taste of the real things, like after nursing school. So to me, those were like little glimpses of like, oh, this is coming. Or like, oh, like, okay, this is what it'll actually look like. So I think the hardest thing for me is when your schedules kind of conflict in a way you wouldn't necessarily like. So having 3 exams, or like my first clinical is on Sunday, you know, so for peds. So that kind of stuff does get hard. And I have to say, like, also the connections part, because nursing school is like in its own little realm. And I mean, you're kind of in the same classes with the same people. And that can be a great thing with connecting with nursing majors and feeling that sense of community. But especially coming from Oxford, I made my friends in that campus and in that very small community. So I came here and then we all went our separate ways. I'm very lucky, and something that helped me the most was living with 3 of my best friends at Claremont, actually. And they're all different majors, but I feel like that's how I've connected with them the most, is just seeing them in the living room, like little glimpses like that. So I can say I'm lucky in that regard, but honestly, I do have to say probably connections is the biggest difficulty, just because you can get so sucked up in nursing school and you're just kind of like getting done what needs to be done and kind of like forgetting about other things. But it's doable, and then also time management is very difficult. It's a delicate balance, if you will.
Also, really quick, Claremont is technically on-campus housing for upperclassmen. So if any of you were to live or want to live on campus next year, that's what you're going to look at. And I would say, honestly, if you're really considering coming to school here, I'd seriously try to start looking at housing options right now. I have a lot of friends who are transfer students who live like 30 minutes away, just because they had no idea of like what central location they were supposed to be looking at. And I think also trying to connect with other, whether it be BSNs or people who are going to school here, just to make your housing more affordable and or even just simpler. I would say that if you don't have a definite mode of transportation, definitely take a look at Claremont. It is, I would say, like kind of more on the expensive side, but it takes, you do have a shuttle and you have more options that way. But I would, if you take anything away from this, like seriously think about your housing situation, because you don't want to be stuck with having to make a 45-minute commute every day.
Yeah, for sure. I agree with everything they've said. You do have class. So far, we've had class twice a week, and then we have a lab day, we have a clinical day, and then you'll get a day off. Again, that can change based on just what semester you're in, the classes you're in. But I think it's just, like she said, it's not hard. It's just really understanding that you have X amount of classes and you have X amount of exams, you have X amount of assignments, and just getting to it all while also making sure you're okay. You're having some kind of life. And I know that everyone says this, but during nursing school, it will probably be one of the hardest years of your life, just because it's so focused, it's so rigorous, no matter where you go. But I think it's also important to have a life of your own and remember that you need to do things for yourself. And self-care, I think, is very important. So to me, coming in first semester, especially as a transfer, I struggled a lot with taking time for myself. But now, as second semester started, I realized that, you know what, the schoolwork is always going to be there. I just have to learn how to do a better job of managing my time. And maybe instead of waking up at 8, wake up at 7, or I don't know, just different strategies. You will figure out what to do, but do not forget to take care of yourself, because if you don't, you will struggle in school. But yeah, that's another thing I say to take away is take care of yourself. Do not forget about yourself.
I'd also say like take the time to like go to events on campus as well. I find like that's one of my ways that I can actually reach out to some of my friends who are at the business school or like on main campus. Like we just go to events together, and there's so many events on campus that you can definitely find the time to go to one of them together.
Thank you guys for sharing. And that the roommate situation stuff too is a good plug for the Facebook page that we have. So all admitted students received an email about the Facebook page that we have, and that is a perfect place to start talking to people about where you want to live, if you want roommates, especially if you are not at Emory currently. If you're coming from another institution, that's a really great place to start making some of those connections. All right, other questions? All right, we're going to move back.
What are some of the challenges that you would say you had to overcome with the transition from being a sophomore and then diving straight into a professional program?
I think similar answer to the last question, but more so just like making your priorities, and specifically like you are getting a degree that once you graduate, you are going to get a job. And I think in general, in college, especially here, a lot of people are looking at post-licensure type of situations, med school, like law school, those kinds of things. So other people can stay up till like 2 or 3 o'clock in the morning, whether they're studying or just talking or hanging out. Whereas I think you have to be like, nope, I am sorry, I cannot do that today. And it's hard because we're humans and we crave social interaction. It drives us. But that would be like I have a hard time saying no to things, so I think that is my biggest like thing that I've become better at, of just knowing when to say yes and when to say no. I really do think that it seems like a huge mountain right now, but once you get into it, like it's not that big of a transition in terms of what you're doing right now. It's more so just, if anything, in my opinion, your week looks better. You don't have to go to class every single day. You get to be a person and see what like kind of acting in the real world looks like, and you don't necessarily have all of the responsibility or anybody's like life technically in your hands at that moment. So yeah, I don't think it's like it's definitely, I'm not trying to undersell it, but it's not as scary as it seems right now.
I would say my biggest challenge was the realization that you have to study. And I don't mean like, oh yeah, like starting 2 days before an exam. A week. You have to, and I swear it didn't take me until like this semester, like pharmacology, until it fully set in, because like, of course, like you study and you prepare, but this is serious, like a lot of content in a little brief periods of time. You have an hour and 15 minutes, like twice a week for most of these classes, and you are shoved so much information and it flies by. And to be quite honest, it's really hard to pay attention in class, and most of it is just reviewing on your own. But it is so important to stay on top of your work and to study as you go along. And I think that was something that was really difficult for me, is because I viewed studying as like, oh, I have an exam coming up, let me start. But really, it was the best thing, and kind of like late bloomer on this, but realizing like reviewing and studying was so important to like my academic success in the nursing school. But I will say, I do think people underestimate like how hard your prerequisites are. Like you all did them, you're here. Like anatomy was horrid, to say the least. So that does kind of prepare you for like the difficulty, but it's just, while it's all difficult and you have to actually study, I will have to say that studying for these classes was far better than the prereqs, because I found that I had that interest and you have that passion. I mean, you're all here, you have interest in the profession, you're all here for different reasons. And for me, like, I definitely found that like joy in studying these things, because you're learning things that are actually valuable to things you will do in the real world. Like the content you're learning is a reflection of things you'll be practicing in your clinical, things you'll be hands-on learning and doing in lab. So while that's challenging to accept that you will have hours of studying, you will be sat in the library for like longer than you'd like, that was challenging, but also the saying no to things, really hard. Like, of course, no one wants to say no to like a Friday night, but you have a Saturday clinical, or like you want to go out on Saturday, you have a Sunday clinical. Like there's certain things you just have to prioritize. and that is sleep. And so just certain things you have to say no to. I also struggled with that. But the more you stay on top of things and study, like the more you can say yes to. So again, it's back to that, not to say it again, but very delicate balance that is doable. But yeah, I think acknowledging how much work you do have to put into the academics was quite hard.
Bouncing off of Mackenzie there, it's so crazy. Like, professors will be like, make sure you understand the content and don't just memorize it, but like actually do that. Like, if you understand stuff, you won't have to memorize it, and it's kind of crazy. But what you learn in like AMP and stuff, like you're gonna need it for patho, you're gonna need it for the years after, like you're gonna need your stuff. So just understanding content instead of just memorizing it, cause listen, if I memorize patho, oh no. I don't remember half the things that I memorize, like honestly. So just understand things, and then find a calendar that works for you, 100%.
A notion, if you will.
Yeah.
All right, other questions? We're going to kind of move over and then down.
Just to kind of stay on the studying topic, so I was wondering if you know of any good resources for studying that offer like really good practice tests and quizzes, because that's personally for me how I retain information the most is through like trial and error. So I was just wondering if you guys knew of any of that, and then just also just any like general studying tips, which I mean you guys kind of just covered, but if there are any more in-depth like tips.
Sure, I'd love to talk to you because I am the same way. I think it's also important to identify how you study because every person is also different. I'm sure even between the four of us, we do 4 different methods. But as for practice tests and quizzes or just testing yourself, based on the teacher, based on the class, they will offer you some questions. They'll offer you like practice exams before. We also have SI sessions or GTF sessions. I forget what the SI one stands for, but the GTF is basically where a graduate student who has already taken this course previously helps you, and they have like maybe once or twice a week Zoom sessions outside of class where they will sit with you, review the material, but also come up with questions either from the professor, past exams, or even just online and what they have done. So that definitely is an option. Outside of that, I mean, I'm sure you guys know you can make flashcards. You can form a little study group, and you guys can come up with questions on yourself. If there's 3 people, each of you can master a topic and then come up with like a little quiz. And I think study group has really helped me kind of understand where I am, understand where other people are, and just kind of form all of our ideas together to end up on the same page. But you do have to sometimes put in the work, depending on the class, to go online and search up the questions or reach out to your professor and be like, hey, like, I don't know how to actually apply this material. Can you help me? And they will sit with you and they will help you.
Also, ATI is a software that you all will be given like a username and password to. It has thousands and thousands of practice questions that are specifically worded the way that your certification exam is going to be worded, and those questions are the most difficult, and it kind of changes your way of thinking, but a lot of professors do reuse questions from there or just phrase them in a similar manner. I also use ChatGPT by like kind of copy and pasting, not like that. I copy and paste the learning objectives that our teachers give to us, and then I say, can you like give me multiple choice questions, and I practice that way too, which is a great way of like your teacher's telling you that you need to understand a concept, and then it spits out a question that's relevant to that concept.
I will say, I know I just said it's hard to pay attention in class. Pay attention in class. Go to class. I know no one wants to get up for an 8:30. Actually, I think it's 8 o'clock your first semester. No one wants to get up. No one wants to go. But you save yourself, again, hard lesson. You save yourself so much time by just paying attention in class for an hour and 15 minutes. Because let's be honest, are you really going to go back and watch the videos the teachers post? No. So just go to class. You really do soak up at least some of the information, and then going back and reviewing the slides, especially this semester, going to class is very, very important, because if you miss one class, you've missed, like, especially with PEDS. PEDS is only for half the semester. It is very fast paced. You miss one class, you miss a whole load of questions that are going to be on the exam in like a week. So going to class, and then they're all PowerPoint based. So I am a person that very much likes to write on the slides. I download the slides before the class. The teachers will post them, write directly on the slides. And then when I get home, I either review the slides. And then this semester, especially with pharmacology, I convert the slides to flashcards. And for me, repetition is very big. I'm especially very visual. So adding like an image to the slide or something to associate with, and then just going through the flashcards. And I like to add all the slides to the exam. I mean, the like Quizlet, just because I don't really have to make a study guide for the exam. Not only am I just like learning along the way, but then I don't have to have the effort of creating a 20-page study guide for the exam. It's just repetition and going through everything has been really helpful, because then again, it's not memorization, but it's like actual understanding. As much as it sucks to, actually have to like completely understand a whole concept for an exam, and it seems like very daunting, memorization just doesn't really, to an extent, it doesn't really help you. So that's been very important to me. It's just reviewing and repetition.
On top of GTFs, professors also offer like office hours and stuff like that, and then if you need them, just email them and they'll respond to you as well.
Hi, could y'all suggest some good places to study?
Rollins, right next door to the nursing school. Honestly, grabbing lunch from Rollins Cafe as well.
I never thought I was this person, but I'm a library person. I've learned I cannot study in my room. Thankfully, I live at Claremont, so even if I have the slightest inkling of like, God, I need to study, I'll just get up, go straight to campus. I really like the Depot, which is like Caldi's, but the one closest to here, especially because it's like in our territory, like it's pretty like walkable too, and it feels like a little coffee shop, so you feel like you're kind of somewhere else other than campus. But yeah, the library, and then if I'm getting really serious, I'll go to like first floor, basement, no window library. I'll just like sit in there. But yeah, going off campus with friends that drive is also a great way to keep up with those friends, but also study. But normally I can't study with other people. So.
Also, I don't know if you guys have been there, but the ENLC is where simulation occurs, and there's a lot of study area there as well. And there's a bunch of there's a couple of coffee shops nearby and food nearby. So if you have a Saturday and you're like, I'm going to study all day, you're not like stranded in the middle of nowhere.
So there are also like multiple libraries. I don't know the exact number, but I feel like there are more than 10 at least, I'm going to say. So you are able to go to 11, sorry. There are a lot of libraries. I've studied in here. I've studied in Rollins. It's really nice. I also go to the main campus library, and there are like a bazillion floors, what feels like, and they have like not breakout rooms. You kind of study rooms, where like you can schedule them and for X amount of hours, and I just sit in there either by myself or with a friend, and I'll just study. I think you'll just also have to just find your place and just what feels comfortable for you. But there are a lot of options. You can even study outside when it's nice and beautiful out. Whatever works for you.
Were you guys placed into all of your clinicals that you wanted to get into?
Yes. That is another thing that I think once you come here, you do need to be what's a good word? Patient, adaptable, flexible. Sometimes you do not get to choose what hospital you go to, what floor you end up on. It's about having an open mind, and sometimes you won't get your clinical placement until 2 weeks before, and that's the administration is doing the best that they can to place every single person in a space. So far there's not been a person that hasn't went to clinical, but it may have been a little bit frustrating, or if you're very type A and planner and want to know everything 3 months in advance, I would not say that's the way that things happen, but that's okay too.
Does it work by you can put what specialty or floor you want to go to, and they try to get you into that? How does that really play out?
Yeah, so you
So for your second semester, you'll get a choice of like doing didactic or clinical. So you'll either choose like if you want to take your classes together with your clinicals, or if you want to take like all your classes and your clinicals. But like, not really, unless you're VA, so VANAP program. Then you'll be placed with Veterans Affairs.
Yeah, so for first semester, we only had one clinical, that was the foundations. So with that, you can only go to Emory hospitals. And in that, you don't really have a say of, I want to be on the cardio, I want to be on the cardio for GI. Like, you don't really get to necessarily do that. But then for second semester, where we are right now, our semester is split into two, where it's med surg and population health, and then the other half is pediatrics. So there, in that survey Rachel was talking about, like, you get to choose, like, which one do you prefer, and then you get to be like, which hospitals do you want? But just because you put that down does not mean you will get it. Right now I have Saturday clinical. If you asked me, do you want Saturday clinical? I would have said no, but it just happened that way. But right now where we are at, she has Sunday. You probably will at least once in your semester or in your time at Emory have a weekend clinical. It's just the way it is. It's just fair for people to rotate. They do try to do that as well. But if you do have like a serious problem with the clinical, you can always appeal it. You can talk to someone. Again, I can't guarantee that it'll happen, but you don't necessarily get a say, but you can appeal it. And it has worked out. I mean, I don't like Saturday clinical, but it worked out for me. I like it now, so you might learn something about yourself.
I'll also say, like, if you talk to your instructor when you're there, they can find you floors. So, like, I asked my instructor, like, I'm really interested in the ICU. She ended up taking us to the ED. Like, it's a little different, but, like, we, like, going to different floors and stuff. We also got to check out, like, the helicopters, so, like, flight nursing and stuff. So, it's pretty cool.
I'm going to say, with my very first clinical, I don't have a car currently on campus. Which is why I prioritize Claremont, because they have a C route that comes every like 5 minutes on weekdays. It's just very accessible, and for me, I knew that's what worked. And for clinicals, especially with people who don't have a car or commuting is like very difficult, clinical placement is going to be very tough for you, because I got Emory St. Joseph's, which is in the mornings at like 6 a.m. It is a breezy 20 minutes, if you will. Like, Sarah did the work, she drove. But then on the way back, and especially because during your first semester, it's not the full 12 hours, so it's 7 to 5. 5 p.m. traffic would make the way back like an hour and 15, an hour and a half. And then that's after being there all day. So that, to be honest, was like breaking point for me. That was not good. But again, like, I had that clinical during a weekday, and I was happy because, sure, that was tough during the week. Then you get to the weekend, you have a weekend. But now, especially for peds, I got my peds placement I wanted. I got Eggleston, which is literally walking distance from Claremont. So I'm going to be walking to my Sunday clinical. So you give and take, and that's kind of what you have to accept. Is like, you're not going to get your first choice, which you are able to rank, but not rank, but list the 3 places you'd want the most. You don't get to put number 1, number 2, number 3, but you do get to say your preferences. You're not going to win in every single aspect, and your schedule isn't going to, especially me, I like what was said, like, I'm very type A, I'm very organized, I like knowing exactly what my schedule is going to look like. And I feel like that's been a learning process, but very good for me to get me out of my comfort zone, just because I've had to accept, like, I'm not going to be completely in control of like what my schedule is. But I liked St. Joseph's for the most part, and I think I learned a lot. And I am going to be at St. Joseph's again for my med-surg clinical this upcoming semester. But everyone wants Emory University Hospital. Everyone wants to be on campus. And you know what? That's just not going to happen for everyone. So I think that was definitely tough to accept, and especially with cars, not a lot of people drive. So, of course, you're going to want something close. And there is an appeal process, but keep in mind they can't accommodate everyone. And especially, like, our class sizes are a little bigger. And it's been a learning curve for us and for staff, too. So they are doing their best. And I'm sure they get 50,000 emails. And I'm sure it's hard for you. And you're like, well, God, I'm 40 minutes away. But imagine trying to juggle making everybody happy. It's just not going to happen. And it does make it difficult in the moment, but there's give and take. So sure, it's like a faraway clinical in a hospital like you wouldn't have wanted, but you may have an amazing instructor or may have an amazing experience. So in some ways where things may lack or not look a certain way you want, things do work out in a way where there's some give and take, but you have to be willing to like, no, I'm not going to get the exact clinical I want. Some people wanted peds first and some people wanted med-surg first. I luckily got pediatrics first. That's what I ranked, but some people got switched around, so they didn't even get what they wanted in that regard. But it works out, and you just have to be very positive. I'll say that.
Yeah, you're automatically placed in clinicals. I think they probably would have mentioned this with the session with Dr. Baker. And it's a generalist program, which means that you're going to get experience in multiple different units, as these students have kind of mentioned with like pediatrics and med-surg. So you're never going to only be in one sort of clinical experience. That's not the point of the program. You're supposed to get experiences in multiple different types of units because you never know what interests might come up that you didn't know about before when you get that experience.
Which to add on, if you don't like it, it's temporary. So
very true. All right. Some other question? Yeah.
Yeah, I had a question about externship opportunities. So, if you guys are doing an externship this summer, I was wondering how your experiences of searching for the options and like applying went.
We're all kind of, I don't know about that, but still in the application process. I would say another big thing that I didn't know about when I came in, once you enter the program, I would say in the month of November to December, you want to start thinking about, where do I want to be this summer? Do I want to go home? Do I want to stay in Atlanta? What specialty am I interested in? And then from there, start researching of what kind of hospital, if that's what your interest is, and do they have an externship program? Then once you figure that out, try to navigate when their application opens. A lot of hospitals have externships. Their application window is open for a week. So if you're not ready if you don't know about it and the week passes, then you missed the application deadline. And the reason why they do that is because so many people applied. It's more so like the very large hospitals, like CHOA, there was a short window, NYU, there's a short window. It's like Duke, like the kind of like big names in terms of like, if your priority is really just, I want to work, there's smaller scale hospitals have a lot of opportunities. You're not going to be in a situation of, oh, I didn't get anything. Somebody will take you. But it does feel a little bit similar to the college application process again, a little bit. And I would say that we do have a career services person. His name is Andrew Plush. He's amazing. First semester, you'll start on a new resume that's completely formatted than whatever resume you have right now. And also just working on professional development in terms of how do you hold yourself and how do you kind of speak on your experiences and speak about yourself as a person in a positive light, so to kind of get those opportunities. So yes, I think that's really good that you're thinking about that now. I had no idea what that was. And kind of as we're saying, it is a lot at once, so you will be overwhelmed, but it's good to kind of have in the back of your head of just where your priorities lie. And also in terms of what an externship looks like, if you are interested in a specialty, that's the way to do it. Because as we're talking about right now, the clinical experiences that you have at first are more general. And if your priority is you want to end up in the ED or peds or the ICU, then you should be looking for that for your summer to hopefully help you get a job once you graduate.
The two things that I felt were very valuable to me, because I'm still also in the externship process, but I decided I want to stay home because it is expensive to live elsewhere than your home and go to hospitals other than your local ones. So I'm looking locally, and so that process is going to be different for everyone, but also they email you about a lot of the bigger externship opportunities. So just, if you're not an email person, become an email person. I check it religiously. Never thought I would say that, but here we are. And then something I did was try to start on because I had heard from my senior friends who had already been through the process that you would have to have a resume ready. So I started trying to reach out and get appointments at career services with Andrew. He said, and this is true, you can't make an appointment to actively sit with him and go through your resume and your experience until you are in the nursing school, which technically isn't, or at least for me, I think I had problems because I was from Oxford too, isn't until August. So you can't make an appointment with him until August, but easily accessible are the resume guidelines. The type of wording you'd like to use and all that stuff is readily available for you to use. So I had that already. I formatted it and everything. And then by the end of August, I was able to make an appointment with him and my resume was done. So getting that out of the way also before everything else adds up. And this seems like a less big thing on your plate in the span of all your 57 other classes and responsibilities. Getting that done was very important, and it just made it more easy. So if they did email an opportunity, I just applied because I had that done. But then also because something I guess I underestimated was how fast you really do have to kind of figure out what you like. I wasn't one of those people. I always knew I wanted to do nursing, had no clue what kind of specialty. And that's also okay. And that's something you'll discover during nursing school. But something that really expedited that process was I shadowed at a hospital over the summer before I came here. And that was one of the best things I ever did. I reached out to 2 of my local hospitals. One of them had an opportunity for nursing students. You have to show like you're currently enrolled in a nursing school, and you have to, of course, like complete their sort of like security clearance, whatever. But I got up to 30 hours of observation, and I had a specific nurse I was in contact with, like family friend, and she was in a CVICU. But then through the wonderful staff there, they gave me other opportunities. So I also shadowed in a labor and delivery and postpartum unit, and just by simply asking, reaching out, I saw a twin C-section, and then I almost saw open heart surgery, and then I was constantly in the CVICU experiencing new things. And while my interest is in labor and delivery, as I was spending a lot of time there, I did find interest in the ICU, and so now I'm kind of focused on CVICU, ICU. So that definitely helped. And that also kind of made me excited for nursing school, because the summer before, you're kind of like shaking in your boots a little bit. You're like, oh God, what's coming? And so that kind of made it like, okay, like I have a passion for this. This is exciting. So like, and you'll also get that in your clinicals. But for me, shadowing, I was able to directly reach out, and there was less anxiety with observation than there was like getting opportunities in clinical settings. So like asking to do specific skills because you can't touch anything. You're not a nursing student yet because it's your summer before. So that was very helpful to me, and preparing my resume beforehand was also very helpful. But again, we're all still in the process, so ask me again when I actually get an externship.
You will receive a lot, and I mean a lot of emails about opportunities, especially from Andrew Plush as well. So yeah, you'll get those opportunities, especially your first semester.
He's incredible and blunt and very to the point, and he will make your resume look amazing.
Thank you.
And we have time for maybe one more question before lunch, maybe 2 if they're short. I know you've had your hand up for a while down here in front.
With clinicals, do you feel like you get enough hands-on experience to like insert IVs or whatever the case may be? Do you feel like you get enough of that while you're in the hospital, or do you feel like you don't get enough because they're not supportive?
So I think that varies from hospital to hospital and from clinical instructor. I will be very honest and say I probably had a not so great first clinical experience because of our instructor. And again, that varies from person to person. It's luck. You don't really get to choose your instructor. You don't get to choose your place. So I felt like I missed a lot of confidence growing and sort of like growth in that aspect of hands-on. Like some instructors really like took their clinical students and pushed them right in and gave them patients and was like, do this, administer this. And I felt like I kind of missed that because my instructor was very hands-off and then also didn't initiate a lot of opportunities. But again, while you still have that sort of negative aspect, things do work out in a certain way to where something will compensate. You'll get good aspects too. So for me, the nurses were very important because they did see that. And I mean, the charge nurse like took us on and was like, do you want to do this? Do you want to administer this? So nurses step in, and then they also are very willing, more than willing, to hand something off to you that they can because they have a lot on their plate. They're going to want some help. So for me, I felt like in that aspect, it did affect sort of like my confidence in like volunteering in clinical settings. Like, oh, I'll do that. Oh, I can do that kind of thing, which I feel like is very important. But I did have wonderful health assessment lab instructor, and your first semester of labs and skills are so important because I felt like what I kind of lacked in that clinical setting, I had lab, and I had a teacher who would take the time and teach all the things I was sort of lacking in one area. So again, like sometimes clinical isn't going to be that. It is very exciting and it is a taste of like the real world, but sometimes it's not going to be exactly what you envision. And I feel like that was a little bit of a blow my first semester, but my lab instructor was absolutely wonderful and she definitely fostered different things.
I'd say anytime you get an opportunity, just say yes. Like, if you want to go do something, just say yes. Because a nurse will come by and be like, hey, do you guys want to do this? Just say yes and follow them. I got to see, like, blood transfusions with pediatrics, put in IVs, give injections. I mean, honestly, your first semester is really for you to do, like, patient interaction and for you to kind of get used to the hospital a little bit. But I did get to see a lot my first semester and this latest block, too. So, yeah, just say yes.
Please say yes. And even if like you want to do something, ask. Like, what's the worst that's going to happen? They're going to say no. And then you say, okay. Like, there's nothing wrong with that. I'm sorry about your experience, but my first semester experience, I loved my instructor. I was at the Emory Decatur Hospital, and I was on a cardiac telemetry floor, which does not sound that exciting. I went into it like all my friends had they were on like an oncology floor, and I was like, why am I on a cardio floor? But I ended up loving it. My instructor was amazing, and I did a lot. I helped administer medications, injections, and even changing a bed, which may sound horrible. Like, you learn a lot. Even giving a bed bath, like, those are basic skills. Like, as a nurse, you need to know because you never know when you might have to do that. And those skills that you learn in lab or in first semester, like, you need, and everything will build on top of that. But yeah, when you're not doing anything in the hospital, the nurses will ask you, and you should go ask them, like, hey, I am here, can I help with anything? I would love to, and they would be more than willing to help you, to teach you, to involve you. Just seize every opportunity and make the best out of it.
It also sounds like you guys are going to be in nursing homes potentially your first semester, so the experience that we're speaking on right now is a little bit different than you, and I think that is going to give you guys a great opportunity to really prioritize like patient-centered care, especially in a nursing home where people probably just want to talk to somebody and practice like speaking in that way, and also like the very basic skills. And one other thing that I'll say is definitely take lab seriously. It's long and it's frustrating at times, but when you take lab seriously and you realize right now I'm in a situation where I have all the tools that I need to learn how to do this in the real setting. Once you're in the real setting, you will have confidence that you know how to do that thing. So when a nurse asks you, do you know how to do this? You can say, yes, I do. Not like, that's scary, because it is. But when you like kind of have your skills and like cement them, you'll feel better when it comes time to really doing it.
But it is also, sorry, I just want to say something real quick. It is also okay to say, no, I don't know how to. Can you teach me? We're not going to know everything. And even some nurses, you're not going to know everything because you haven't encountered every single type of patient, every single type of disease or any problem. But do not be afraid to say, no, I don't know how, but can you please teach me? But yes, it is always good to go in with confidence, saying, yes, I can do it, and they will let you.
Thank you guys so much. I know we have more questions. We are at time, but we really appreciate you sharing your experiences and answering the questions today. We do have, if you have other questions for current BSN students, on our website, we do have a platform where you can chat with an ambassador. And that's a really great way, and all these students are student ambassadors. So that is a really great way to kind of ask some of those program or student experience questions that you may not have gotten in today or might come up. So with that, the next piece is going to be ending out with kind of lunch and some fun stuff. So feel free to head outside and grab some lunch.